Good afternoon, and thank you for joining us for today's CMS 1500 webinar. I'm Jen Donovan from the Stakeholder Engagement Unit here at the Workers' Compensation Board. To assist with your questions today, we have several board staff from our Medical Director's Office and our Data Management and Analysis Office. Today's focus will be on the upcoming mandate for providers that you must begin submitting the CMS 1500 Universal Medical Billing Form electronically through a board-approved electronic submission partner effective August 1st, 2025, which is just 26 business days from now. As of August 1st, the board will no longer act on or enforce payment of any paper CMS 1500 bills, and payers can deny them. So converting to electronic submission is critical for providers to continue to get paid for services in treating injured workers. We urge all providers not to wait any longer, and today's webinar is designed to help you understand and comply with the mandate. We will start with a brief overview of the CMS 1500 initiative, review the significant benefits of electronic submission, share the currently available submission partners, and take a look at the submission process. There will be time at the end for your questions. We ask you to please keep your phone lines muted as we will be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We will answer as many questions as we can, but if you have questions we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the coming days. Before we dive into today's presentation, we would like to get some specific feedback from you. If you are not already submitting CMS 1500 bills through an electronic submission partner, what is holding you back? You could please go ahead and let us know in the chat, and we'll give everyone a moment to do that before we get started. Today's presentation will largely center around a critical and fast-approaching component of the CMS 1500 initiative, which is mandatory electronic submission through a board-approved electronic submission partner that takes effect August 1st, 2025. Before delving into the upcoming mandate, we will start with some background on the initiative and discuss the benefits of electronic submission and how well it's going. We'll then review available submission partners, how to register for electronic submission of your CMS 1500 forms, and review the process as well as some additional reminders you should be aware of. We will then spend the rest of the time answering any questions you have. The board transitioned to the universal form to reduce the administrative burden on participating providers who previously had to use separate board-specific forms for their workers' comp patients. Electronic form submission provides an infrastructure to allow the submission of data to the board in an industry-standard format. Since July 1st, 2022, healthcare providers have been required to use the CMS 1500 for all workers' comp medical billing. As part of the initiative, use of prior medical billing reports, including Doctor's Initial Report, Form C4, and Doctor's Progress Report, Form C4.2, have been discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. Please note, provider types who are not permitted to opine on causal relationship or level of impairment are not required to submit this information. And again, beginning August 1st, electronic submission through an electronic submission partner will become mandatory. The board is thrilled with the success of the CMS 1500 form so far. Since July 1st, 2022, more than 16.7 million CMS 1500 forms have been submitted, including 5.5 million electronic submissions through an electronic submission partner. More than 14,800 providers have submitted their CMS 1500 forms electronically through an electronic submission partner. The board provided notification of the new requirement in August and November of 2024, and again in January and March of this year. We want to emphasize that this requirement is mandated regardless of office size or patient population. There are many benefits to providers, which we will go over shortly. We want to highlight that starting August 1st, the board will no longer act on or enforce payment of paper CMS 1500 forms, and workers' compensation payers can deny them. Forms that are submitted prior to August 1st will continue to be processed, but providers are encouraged to transition to electronic submission well in advance of the mandatory date. Now we will take a minute to highlight the many benefits of electronic submission. The first is faster bill payments. Providers typically get paid quicker. Next, we have reduced administrative burden. The electronic submission partner submits the CMS 1500 to the insurer and the board. Some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. Providers will have confirmation within 7 days that their bill was accepted or rejected by the insurer. With date and timestamp acknowledgement of receipt from the insurer, the provider is aware that they do not need to resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. Finally, there is no or low cost. There is a designated CPT code that reimburses providers for up to $1 per transaction. Now we will review the steps providers need to take to register for the electronic billing through an electronic submission partner. Please note this applies to each provider in a practice who treats workers' compensation patients. The medical portal provides access to the online services the board offers, including registration for electronic submission of medical bills to insurers and the board. Once you have accepted the terms of the electronic submission agreement, you can then discuss details of submission with an approved electronic submission partner, also known as a clearinghouse. The electronic submission partner ensures that the medical bill and narrative attachment are sent and accepted by the correct payer and the board. After logging into the medical portal, providers who have not already signed up for electronic submission of the CMS 1500 will see a link for Agreement for Electronic Submission of CMS 1500 under the Billing section. Select the link and select the I Accept button. The provider's name will be added to the listing of providers authorized to submit electronic data, which is updated daily. Once accepted, the link will no longer appear when you sign in again. There are currently 6 approved electronic submission partners. As a reminder, some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. In order to ensure the integrity of the electronic submission process, the board requires all prospective submission partners to engage in a rigorous testing effort. Approved electronic submission partners have executed a legal agreement with the board. For a list of these approved submission partners, visit wcb.ny.gov/submission partners. It's important to note that the board does not endorse any of the electronic submission partners who have shown interest in or who have been approved to provide these services. The board has no knowledge of any other aspect of the electronic submission partner's business. Thus, the board makes no representations or warranties, express or implied, as to any aspect of the electronic submission partner's business. After registering with the board, you may submit the bill and narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit a paper CMS 1500 form to certain, but not all, electronic submission partners. We'll then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS 1500 form must ensure the submission partner they choose has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS 1500 from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. The electronic submission partner will also transmit the billing data, CMS 1500 forms and narrative attachments, and the insurer's acknowledgements of receipt to the board. We ask you to please keep the following in mind. When the CMS 1500 form and narrative is submitted through an electronic submission partner, providers should not mail, fax, or email a duplicate bill to the board. Providers who are required or permitted to do so are strongly encouraged to use the narrative template to create the medical narrative report that must be submitted with the CMS 1500 for ease of locating the essential elements of causal relationship of the injury or illness to the patient's work activities, patient's work status, and temporary impairment percentage. For those using their own template, please remember to include these elements in a highly visible location on your report. Payment may be denied when a bill is submitted improperly, for example, not submitted electronically through an approved electronic submission partner. This is very important. When a WCB case number is available, it must be populated in Field 9A. Failure to do this may result in the CMS 1500 not being matched with the correct case, resulting in delay of review and payment. Providers decide which electronic submission partner they want to use. Costs and services may vary by company. View the board's list of approved electronic submission partners on the CMS 1500 section of the board's website. Providers will have the ability to offset the cost using an electronic submission partner by using code 99080. This was previously a no-charge code in the fee schedule listed as special reports such as insurance forms more than the information conveyed in the usual medical communications or standard reporting form, which may be used as a by-report code up to a maximum value of $1. The code should be placed on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill up to a maximum of $1. Please note, a provider who currently submits a CMS 1500 electronically via an electronic submission partner can bill to offset the cost. Providers should advise MDO of payers who are not reimbursing for the offset, such that we will refer the matter to our payer compliance unit. If the original bill has not been paid by the carrier, providers can submit an HP1 for the entire bill, including the unpaid offset. When billing for a permanency evaluation, the doctor's report of MMI, permanent impairment, form C4.3, must be attached to the CMS 1500 as the medical narrative. If you send a separate C4.3 form to the board, it will be rejected. If there are more than 6 line items for one date of service, you may submit multiple CMS 1500 forms together with the total charge amount appearing only on the last form. Be sure to enter the information correctly on the CMS 1500, including payer and employer detail, as indicated on the requirements page of the board's website. If a board case is apportioned between carriers, you would submit a CMS 1500 to each carrier and bill them at the percentage for each carrier. If the apportionment is a percent for different cases, you would submit a CMS 1500 for each case and carrier for their percentage. If a submission partner is denying submission because they don't have a WCB case number, if they are denying because they do not have a Social Security number, or if submitted bills are not getting into the injured worker's case file, please advise MDO by emailing cms1500@wcb.ny.gov. The WCB case number and Social Security number are both optional fields, so bills should not be denied by the payer for lack of either of these. Additionally, submission partners are required to send the electronic bill to the board as well as the payer in keeping with their agreements with the board and providers. If you submit a paper CMS 1500 bill on or after August 1st, 2025, the payer will not send you payment, but rather an explanation of benefits or explanation of reimbursement that references CARC 16, RARC N34 codes, which indicates your bill was not submitted electronically. In order to be paid, you must resubmit the bill to the payer electronically through an approved electronic submission partner within the statutory time frame, which is 120 days from the day medical care was rendered. We would like to share some other news of interest related to billing. On January 6th, the board issued new guidance to payers to reduce improper objections to medical bills. The new guidance, also published on the board's website, includes when not to file Form C8.1B, a list of reasons that cannot be used to file the form, when Form C8.1B is needed, a list of requirements for proper submission of the form. Just a reminder, earlier this year, the board created a new medical billing dispute section of our website to assist providers and payers with the dispute process. The site details documentation and other requirements for common scenarios. You can visit the link on your screen for additional details. For more information on the CMS 1500 form, including a list of electronic submission partners and discontinued forms, please visit wcb.ny.gov/CMS1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative, and the email address again is cms1500@wcb.ny.gov. As a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates, the same ones our external stakeholders do, by hitting Get WCB Notifications on the bottom of our website. Thank you for taking the time to learn about the CMS 1500 mandate and all the benefits that submitting electronically offers. Before we take time to answer your questions, please take a moment to let us know in the chat if you have not already done so. If you are not already submitting the CMS 1500 electronically using a board-approved submission partner, what is holding you back? Please enter your response in the chat. We will now take some time to answer your questions. You might hear brief silence as we take a moment to review all the questions that have come into the chat, and we will rejoin you again shortly.
Hi, this is Paula from the Medical Director's Office. We have a question from a glaucoma ophthalmology office asking if the electronic submissions are, if they're required to do the electronic submissions. This electronic CMS 1500 initiative applies to workers' comp only. So if you are not treating workers' compensation patients, then this would not be required.
Hi there. There's a question about registering providers for different physical therapy offices. If the providers are board authorized, what further they need to do. If that physical therapist is already board authorized and went through that process, they'll already have a medical portal account. And what they would do is just log into their medical portal account and make sure that they accepted the CMS 1500 electronic submission agreement. If they have, the option disappears after they've accepted it. So if it's not there, they are all set. The billing is done per each of those providers' MPIs. So as long as each of those providers have signed up, accepted the agreement, they are all set to commence and select a submission partner and start submitting electronically.
Hi, this is Audrey Cunningham from the Medical Director's Office. We've gotten a number of questions regarding providers who are currently working with e-billers, and I wanted to just take a moment to make the distinction. A lot of providers are currently using e-billing, but that is separate and apart from contracting with a board-approved XML submission partner. So just because you're e-billing, some of those partners aren't necessarily board-approved submission partners. So take a look at the listing of our partners to make sure that they're actual submission partners that the board has approved, so that you can start submitting your bills electronically via CMS 1500. Hi, we have a question with respect to denying a bill that comes in after August 1st via paper. So if you are a payer and you receive a bill that is not electronic after August 1st, you can deny that bill. You do not need to file a C8.1 if the bill is a paper bill after August 1st. Rather, list the objection on the EOB using CARC 16 and RARC N34. And we have that on our website and have sent out a number of announcements regarding that. But if you have any questions, feel free to reach out. Again, you can deny a bill after August 1st, not by a C8.1, rather listed on the EOB.
Hi, this is Dan. I'm just going to add to Audrey's last comments. If you do use an e-biller or another clearinghouse that submit your bills to the payer, there are some submission partners that work with certain clearinghouses and other e-billers to get your bills to the board. I would check with your clearinghouse, see if they do work with one of our board-approved submission partners to get your bill to both the payer and the board. But if not, if they don't work with one of our submission partners, you'd want to make sure that you're contracted or start to partner with one of our submission partners to make sure that the bill is getting to both the payer and the board.
There's a question, can you contract with more than one submission partner? Yes, there is no limit. There are providers who have contracts with multiple submission partners today, and you can do so as well.
Hi, there's a question with respect to whether or not you as a provider need to send the bill to the payer once you start working with a clearinghouse. And once you start working with a clearinghouse, you send the bill directly to the clearinghouse, and the clearinghouse's responsibility is to then send that bill both to the board and the payer simultaneously. So you will not need to do that yourself.
There's a question asking if the provider's clearinghouse has to reach out to each payer to set up electronic billing. No, very similar to private insurance. Most clearinghouses are going to have that payer information on file. When you electronically bill, they'll have that information and be able to route it electronically to that payer.
Hi, this is Paula from the MDO. There's a question about with the new electronic filing, when can we submit an HP1 since we will know exactly when the payer received the bill? Nothing has changed with that HP1 process. It would be 120 days from the date of the acknowledgement.
Hi, this is Dan. We have a question in regards to whether each provider in the same office has to register as an electronic submission partner, and the answer is yes. It's determined by each provider's MPI would have to register with the board prior to submitting the electronic submission through a submission partner. So make sure to go into the board's Med portal, have each provider agree to the agreement, And then once that is done, the provider will be able to submit electronically through one of the board-approved submission partners. I'll also state that electronic submission for out-of-state providers is required, and out-of-state providers can also register through our medical portal in order to submit electronically.
Hi there. A few more questions regarding paper bills received after August 1st. So paper bills that received after August 1st, a C81B is not warranted. So you can, as a payer, simply list the objection on your EOB as you normally would, and the specific CARC-WARC codes are CARC-16 and WARC-N34. We can put that in the chat, but you do not need to submit a C81 after August 1st for paper bills. Hi, a question as to whether or not bills can be faxed to the payer or to the board, and the answer is no, no faxing of bills.
Hi, everyone. Just to reiterate, out-of-state providers, DME providers, dental providers, all need to submit through a submission partner. It does, if you're treating workers' comp patients, you, after August 1st, will need to use this.
Hi, this is Dan again. I just posted in the chat a link to our webpage that provide examples of the different medical narratives that should be attached to the bill when submitting electronically. So when you do utilize a board-approved submission partner, you'll be able to send the bill, including the attached medical report or any other notes, through to the payer and to the board.
There's a question from a provider's office asking if after August 1st, if board decisions, other CA.1s unrelated to paper billing are still going to be mailed to you or sent to you in the same fashion as today, and the answer is yes. Your board decisions, if you have an objection to a bill that's been decided by the board, you'll continue to get your board decisions by mail.
Hi, this is Dan again. Just want to make sure that everyone understands that any payer or insurer that accepts New York State workers' compensation should be accepting electronic bills currently. If you find that you are working with a payer that is not accepting electronically, please reach out to us here at the board. We did provide a email address to the CMS 1500 at wcb.ny.gov. We'd like to know if any payers are currently not accepting electronically. Thanks.
Hi, this is Jen. I'm seeing a few questions regarding the availability of this presentation. It will be posted to the board's website within the coming days. If you visit wcb.ny.gov and scroll all the way down to the bottom, you will see a link for recorded webinars, and you will find it there. Hi, this is Jen again. I'm seeing several questions regarding office size, either having a very small office or not handling many workers' comp patients. This is mandatory regardless of how small your office is or how few workers' comp patients you do see. So regardless of office size or patient population, this is mandatory beginning August 1st.
And I'll just reiterate a couple things. Out-of-state providers that are submitting bills that are within New York State jurisdiction need to be registered for electronic submission. That's also for any hospitals that submit bills for workers' compensation. Also, in regards to notes or medical narratives, they would be attached to the bill that's submitted to the clearinghouse or board-approved submission partner. So the provider does not need to send anything to the payer or the board. The the electronic submission partner will send both the bill and the notes or medical narrative on the provider's behalf to both the payer and the board.
Hi, underscoring Dan's earlier response as we continue to get questions regarding the medical narrative and notes. So you're sending, as a provider, you're sending the medical narrative notes to the submission partner, and they will in turn send that for you to the board as well as to the payer. Hi, question regarding hospital bills. This will not apply to hospital facilities, so hospitals will continue to use the UBO form.
We have another question about how to register and whether you need to re-register for the medical portal for this initiative. As long as that provider already has a medical portal account, they have logged in and accepted the agreement for electronic submission, they are all set. Once they accept that the first time, that option will no longer be there. So if they do not see it when they're signing in to the medical portal, they have already accepted it and they're all set. There is no other online account with the board you need to create. Your next step would be contracting with a submission partner and setting up your electronic billing with them.
Okay, thank you to everyone for joining us today. In case you missed any responses, the Q&A will be included in the recording that will be available soon. Any questions that were not covered during the Q&A can be directed to CMS 1500 at wcb.ny.gov, and someone will respond to your inquiry as soon as possible. Before we sign off, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the homepage, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook, X, Instagram, and YouTube. Thank you again for joining us, and enjoy the rest of your afternoon.